AIDS can be a manageable disease if I think you have your life in order and if you have all the support systems in place to be able to allow you to maintain management with your medications. When you have providers that are not going to be affirming and welcoming and really are going to deter you or act as behaviors to engage into your care, many folks rather not see a provider because for fear of being misgendered, for fear of being retaliated, for fear of having experiences of transphobia. I mean, that is a main barrier, right? We think about just in general the lived experiences of trans people, particularly trans women at risk for HIV. There are high rates of unemployment, high rates of discrimination, high rates of mental health needs and substance use. And when you think about like all the other things that one has to navigate to be able to maintain and sustain their care, I think those kind of play a big role in being able to be truly engaged in maintaining HIV medication or being engaged in your care. I got into AIDS activism way back in late 1999. As a young queer-identified Filipino growing up in San Francisco in the 80s and 90s, HIV was so much saturated in my consciousness around my education, around kind of risk behaviors, and particularly in San Francisco in the 80s when I heard many gay men particularly were being affected and were dying. And so when I went to school, I knew I wanted to get into social work. However, I didn't qualify to get into social work school, and so I got into public health. What really got me into activism is when I transitioned, after I transitioned in 2000. So I started my transition in 2000 and really got more heavily involved in HIV work, more specifically with trans communities and trans populations. At the time, we knew there was so much more data around injection drug users, gay men who have sex with men, but really nothing. And also, too, at the time, too, there was a lot of efforts really focused on prevention of passing HIV between a mother and a child, but really lacking any kind of prevention efforts focusing on trans folks. With gay men, more specifically, there's a lot more access to prevention messaging and resources more currently, such as treatment as prevention and Truvada and PrEP, and really specific marketing that really targets a population, and even kind of like the visuals that they see each other in those marketing. For trans women, it's a little bit different. There hasn't been much targeted marketing and resources available for trans women to really engage in prevention messaging in a way that is holistic and affirming of their gender identity. There's still a lot of experiences with negative experiences with healthcare providers and discrimination, and I think that contributes to prevention itself and being engaged in prevention, being engaged or even thinking about PrEP. And wanting to take that and having some sort of ability to take it on a regular basis. In terms of thinking through like how do we design prevention programs specifically addressing the needs of trans women at risk for HIV, we really need to be cognizant of the nuances that exist amongst the community. It's so vastly different. I mean, being Black and trans is so vastly different from being Latina and trans and even API. I myself, as a Filipina trans woman of color, I often see myself not even included in these conversations around HIV. It's centered around Black and brown trans women. However, when I see my other friends who are API identified and are living with HIV and struggling just to live and be seen, there's a lot more that hasn't been quite included in the narratives around HIV that we need to really think through and critically respond to, whether it be risk-taking, whether it be access to care, whether it be our own personal experiences with discrimination and transphobia, whether it be our own internalized feelings growing up being different. it's so important that we consider those nuances so that we can have a better response to reducing HIV/AIDS amongst trans women of color. When I think about HIV and HIV care for trans folks, it's really thinking through how do we provide whole person care, whether it be addressing their sense of spirituality, their overall mental health and wellness, their overall physical health, their overall environmental health that really supports them in being able to fully engage in their care and in their own lives. There are unique experiences that exacerbate the experience of isolation and fear and stigma, that it's even far more greater for trans folks when you are living with HIV. I think we know a lot more around HIV risks and behaviors associated with trans women in general. I think a lot of the research studies have really focused on trans women because prevalence rates suggest that they're a greater risk. So when we think about different risks, we think about behavioral risks such as risky behaviors, multiple sex partners, engaging in substance use that inhibit high risk taking. Sex work is really prevalent amongst trans women as a means of survival and not as a choice. There's a lot more high levels of mental health needs that really speak to the issues around risk-taking for trans women. There's also experiences of DV and just really bad relationships, domestic violence and bad relationships that increase their risk in risk-taking, right? Risk for trans guys in HIV, I think it's more focused on trans men who have sex with men, so gay trans men in general. So it's centered around sexual risk behaviors, unprotected sex, and there are a lot of reasons why one would engage in unprotected sex for a variety of different reasons. We know in literature there's also trans guys who experience high rates of isolation and mental health barriers that kind of contributes to their risk taking. There's also high rates of substance use that contributes to risk taking. Many trans men also have reported having no sense of community as opposed to other trans folks, and so many of them find community in online, right? So finding community or finding others who will validate their identity through online apps or online dating, that makes it much more easier to connect with folks, but sometimes increases your risk for higher risk taking. And sometimes for trans folks, sexual activity is an affirmation of your identity, of your self-being, right? You are a sexual human being. And, I think because of kind of the stigma around some of our identities, sometimes we do often take behaviors or risky behaviors that may put us at risk for HIV because of that sense of the need to be affirmed for our gender identity. If you pass, basically you're not identifiable as trans. So that gets really complex, and I think it's more so important for an older generation of trans folks who don't necessarily want to be identified as trans for fear of many different things, right? Discrimination, violence, stigma, and a bunch of other things that contribute to that. For younger generation of trans folks that I see now, there's a wide range of different views and perspectives around passing. One doesn't necessarily have to pass to live your truth. You can just be yourself. One doesn't necessarily have to be male or female. You can be completely in the spectrum of your gender identity and be non-binary, and that's totally okay. And so I think there's different perspectives when we think about passing and what that means for some trans folks.